So if you were here 2 weeks ago, AJ gave an excellent grand rounds on machine learning. And what I took away from his talk, these parabolas control complex algorithms which run computers, that run machines, which are the robots which may replace you in your current job in the near future. AJ also made the assertion that he believes I spend a fair bit of time thinking about the pelvis. I'm not sure if you're going to be replaced in your current job by a machine in the near future, but I can tell you I do spend a fair bit of time thinking about the pelvis. It's for a lot of the reasons Chris alluded to in his presentation. It has a complex shape, and I find it very interesting. But in the famous words of Steven Ranella, you can't escape your own perspective, and I know some of you don't spend a majority of your day thinking about the pelvis, maybe because it's outside the scope of your practice. And so I want to make this topic a little bit more relatable or tangible for everybody in the audience today. So let's take a simple analogy and see if we can achieve that goal. Consider this radiograph. If I put this radiograph up on the slide, everybody sees a displaced Weber B distal fibula fracture. Everybody's managed this either in clinical practice or in part of your residency training. And I would argue that in your mind's eye, when you see that radiograph, you also see this, a simple treatment algorithm for this injury. This patient gets a stress view radiograph, either in the emergency department or in clinic, wherever you're seeing them. And based on the results of that stress view radiograph, we have a defined treatment plan for this patient. If the stress view radiograph demonstrates instability of the ankle, we tend to recommend open reduction and tonal fixation of this injury. If the stress view radiograph demonstrates stability of the ankle mortise, we would typically recommend non-operative intervention. And the nice thing about this decision tree is we have data to support kind of each branch of this algorithm. However, if I put up this radiograph demonstrating a displaced LC1 pelvic ring injury, I would argue many of you don't see that same simple, clean treatment algorithm. And it's not because you learned it in residency and you forgot because you're not thinking about the pelvis anymore. It's because it simply doesn't exist quite yet. But I would argue that we're on the cusp of developing this algorithm, which is why I find this topic so fascinating. And it's why I hope you'll enjoy this presentation.